that all over the world, the focus is shifting from organizations to consumer. So far, everywhere in the world, including in India, healthcare was mostly focused on the institutions, organizations, hospitals, and the technology upgradation there has been very fast. But at the same time, now the focus is changing, and the consumer, the ordinary consumer, is thinking of having his health information with himself. So, with that change or shift from the focus, what has come in is consumer centricity in healthcare. Because of this consumer centricity in healthcare, there is a need to address to the consumer directly. So, the technology adoption also has started shifting from the healthcare providers like hospitals and diagnostic centers to how a consumer can utilize the health related services at his wish, will, and pleasure anytime, anywhere, using any device, that kind of thing. So that's one thing. Second thing, healthcare technology in India has been not as in advanced stages as many other technologies like say communication, mobile or banking. Healthcare has been pretty a little bit far off compared to the standards in other industries, and that's another reason that everybody is suddenly feeling that this particular area is little bit neglected, and this is where the technology upgradation is required as of now. See, the key thing is that the healthcare market in India is highly fragmented, and consumer doesn't have a choice. So even though it is highly fragmented, at the same time there is not many avenues for the consumer to get the things required to meet his healthcare needs as and when wherever it is required with convenience. So you have medical stores here and there almost everywhere, but then at the same time you do not have any way to figure out how you can have access to large number of inventory items. You are limited to very small fragmented few items which are available with your nearby health store, and that is where we felt that if we can provide the consumer a choice to have a large number of SKUs or large number of devices or large care of healthcare items at his disposal, and that too at his convenience, so that using his mobile or using his PC, he can order whatever he wishes to and gets delivered in time. That will be a great service to the consumer. Another thing is that because of either the traffic problem or because of the aging population in India as well, there is a lot of need for the chronic medication where people do not wish to travel to go to the nearby store and order the same. So providing them the facility or the convenience at their doorstep is another thing. So thinking about that, knowing that as of now, even though there are some initiatives that have taken place in this field, still there is a huge gap. Online facilities, availability of online facilities to the consumer is still very limited in healthcare industry, unlike in many other areas, be it online banking, be it retail, or be it mobility. So that is where we felt that there is a big gap here, and we will really be able to do a service to consumer by providing him the availability as well as convenience at his disposal as per his time, as per his needs. I see the biggest impediment is lack of standardization. Right now, hospitals, diagnostic centers, doctors, um, service providers, medical stores, distributors, they do not adhere to any common standard of how the data should be available with them or managed by them. Another issue that we see that nobody is thinking of the patient as the center of the universe. it is always the center of their own facility, their own organization, their own hospital kind of thing. So that is the biggest impediment has been there, that everybody thought that okay, let me upgrade my technology whatever I'm using in the hospital, but nobody thought that what patient can access. So providing that access to patient, that was not there at all, that was not the focus at all, and that is why things have not moved in the right direction. Now what has happened is, suddenly in India in the past couple of years, a decade or maybe even less than that, there is a availability of a smartphone with almost everybody throughout the India. And with the availability of the smartphone, the consumer expects that I will have my health related information with myself. So I need not be dependent on others. I should rather keep the things with me rather than keeping things in with the hospitals or doctors or diagnostic centers or in some paper which I cannot read, I cannot figure out what it is. So that shift is needed, and technology upgradation, because it was always focused on individual units rather than across the organizations or across the population of the consumers. That is why nobody thought of the right technology upgradation in those areas. But however, at the same time, there is now in the coming years, there is no option but for everybody but to come out with the common threads by which data can be transmitted from one kind of organization to another kind of organization. Tomorrow consumer would like to know that what my doctor has prescribed, what my diagnostic center had given me the information. Can I take both the information? Can I go to a hospital? Can I get advanced treatment if needed? So for that, he needs to have his records, his technology in a digital way, and if possible in a standardized, unique digital way, which is common across the industry. So that's the need. So far nobody had thought of that need, but because that need is there, in reality it is there and consumer is demanding, so there is no other way but to go in for massive technology upgradation in this field in the I will say maybe 6 months to 2 years to come. Awareness of consumers and consumer being the center of the universe. It is not only in healthcare, everywhere else, be it entertainment, be it banking, financial sector, be it any other service industry like retail, it is the now consumer that is becoming the center, not the organizations. It is no longer about B2B or B2C, it is simply business to individual. At this what do I say? It is at the discretion of the individual. He wants his services in his own way. He wants his services on his own device. He wants his services which he needs to be made available whenever he wants, that kind of thing. And the technology, core technology, which is not related to healthcare technology, but the smartphones, Wi-Fi, enabling wireless communication even in the rural areas, that has provided power to consumer where he is demanding that he needs these things at his wish, will and pleasure at that time. So now he has the power, and because consumer has the power and he can choose, so it will force the hospitals, the doctors, the clinics, the diagnostic centers, the health insurance companies to provide their services, to offer their services to cater to normal consumers who are not coming to them. So far it was that you go to the hospital, only then hospital will talk to you. Now very shortly you will see a change where hospitals will have to go to the consumers, because the consumer will demand, I want to know that for this particular thing, who are your doctors, what are their reviews, what kind of facilities that you are providing, what is your post-hospitalization support, and he wants to compare with hospital A, hospital B, hospital C, hospital D. So then there is no other choice but for the large service providers in this industry, be it medicine manufacturers or retailers, or be it hospitals, or be it diagnostic centers or other service providers, to go to the consumer and because they need to go to the consumer, so that will definitely demand that they upgrade their technology and they provide easy accessibility to the patients and the consumers in particular.